Okay, we're recording.
Let me know when you let everyone in.
Okay, go ahead.
All right. Good afternoon, everyone. Thanks for joining our webinar today. I'm Emily Beauregard. I'm the Director of Kentucky Voices for Health and a member of the ThriveKY Campaign. As usual, we have a big agenda to cover today. Our goal with these briefings is to make sure that you get the latest information on the state and federal policy response to COVID-19, that you get updates on safety net programs and opportunities to educate and advocate. So we'll try not to repeat too much of what we've shared before. We'll give you a little context, but we really want to focus on what's changed in the past month and what we're anticipating in the future. Angela, why don't we move to the next slide? All right, so if you're already familiar with our ThriveKY campaign, and I hope that most of you are by now, you know that our core purpose is to meet the basic needs of every Kentuckian through systemic change. And on this slide, you can see our shared principles. We strongly believe that the only way for all Kentuckians to thrive is through anti-racist and anti-poverty policies that will lead to more equitable and a more just Commonwealth. So we'll be touching on a number of those policy solutions today. And let's go to the next slide. Do we have a list of our campaign partners too? Yeah, here it is. So these are the campaign partners, and many of these folks are going to be on today's call, talking to you about their particular area of expertise. We can go to the next slide. And this is the agenda that we're going to be covering today. And just a little bit of housekeeping. We are recording this webinar. We'll be sending out a link to the recording and the slides tomorrow, and we'll be sure to share those in our weekly newsletter as well. We do have a number of folks on the phone today or on the webinar, so if you could mute yourself, that would be a big help. And then you can use the chat box if you have questions or comments, and we'll try to address those throughout or at the end for Q&A, depending on how quickly we're getting through things. And then we can go to the next slide. Okay, we're going to start with an economic overview from Dustin Pugel, so I'm going to turn it over to Dustin.
Hey everybody, my name is Dustin Pugel. I'm the Senior Policy Analyst with the Kentucky Center for Economic Policy. We are a nonprofit, nonpartisan research and advocacy group out of Berea and Louisville. Now we've got a couple folks there. And our job is to provide research and advocacy and public education on policy that improves the lives of all Kentuckians with a specific eye toward folks who are underpaid and you know, just usually require a little more attention. So we wanted to start each of these with just sort of a background on where we are economically as a state right now, because that sort of drives the rest of the policy response. And so I've got a few slides I want to run through just to kind of give us a base understanding of where we are at the moment. So I've shown this chart before. The line graph there on the left is the number of non-farm jobs that we have as a state. And you know, that initial dip is the Great Recession. And ever since then, we've been on a pretty smooth trajectory upward, fairly steady increase. And then starting in March, we had a very large decline in jobs before any sort of stay-at-home orders came out. It was just people being concerned about going out, and so they began to stay home, and some businesses started to voluntarily slow down, and that resulted in some job loss. But then April hit, and we did have a mandatory stay-at-home order, and that's where you see that sort of nosedive. We lost in 1 month roughly 300,000 jobs in the state, which is unheard of. We've never had a situation like that since we've been measuring jobs. We began in February with roughly 1.9 million jobs. By the end of April, we had 1.6 million. So we've made that up some. We're back up to around 1.7 million jobs, but we're still 184,000 shy, or around 9.5% less than what we had in February. I'll talk about this a little later, but you know, a lot of places are actually starting to rehire. Government jobs are one area where we've actually started to see an increase in layoffs. And that's largely due to the drop in revenues, both state and local, and the lack of federal aid to state and local governments for just ongoing operating expenses. And that's concerning for a number of reasons. Probably the biggest one is that those folks provide vital services that we all need, that we're going to talk about during this webinar. And so if fewer folks be able to provide those services, that just extends the hardship that Kentuckians are facing right now. The other trend that is somewhat concerning right now is that we've started to see a recovery of folks who had lost their jobs temporarily, but we're seeing an increase in the number of folks who think that they're losing their jobs permanently from business closures or just straight layoffs without the expectation of being called back. So let's move on to the next slide. Of course, you know, I don't think we're surprised by the fact that Black Kentuckians are hit harder by layoffs than white Kentuckians or Kentuckians as a whole. This chart on the left shows the folks who have been able to take unemployment insurance in the state as of April. We probably have one more month of data. I just haven't updated this chart in a while, but just wanted to point out that even though Black Kentuckians make up 9.8% of the workforce, they make up 12.4% of the unemployment insurance claims, whereas white Kentuckians make up 86, almost 87% of the workforce, but only 85% of the unemployment insurance claims. It's also important to point out that Black Kentuckians have a higher labor force participation rate. More of them actually are in the labor market than any other, than Kentuckians on average and white Kentuckians, but they tend to have higher unemployment. They tend to have lower wages. They're less likely to have paid time off. And we know that they have a higher exposure to COVID-19. This is not, you know, again, a surprise. It's based off of a long history of policies that were rooted in racism that may have been stopped or overturned, but have not yet been corrected for. And so, you know, we remain here, and it's going to take anti-racist policy to begin to undo that. So let's move on to the next slide. I wanted to say a little bit about wages. We're starting to see some good data come out on how this has affected wages and households throughout Kentucky. We know from a really amazing data source called the Household Pulse Survey. It's a weekly survey of Kentucky households, that half of Kentuckians, or at least Kentucky adults, have reported losing income in their households. Of those, 55% were households with children, 63% were low-income households, 59% were Black households, and then 88% of Hispanic and Latinx households reported losing household income. I think I misstated there. I mean 55% of households with children, not 55% were households with children. You know, this is all while the PUC, the extra $600 a week, which we'll talk about later, for unemployment insurance expired. This is after, you know, we know that stimulus checks have largely been spent at this point, even though there are some who have not received it yet. We'll get to that again in a little while. And we also know that Black and other low-income households tend to have less savings to fall back on. And we also know that, and again, we'll touch on this later, but the moratorium on rent-based evictions has been lifted or is lifting soon. And with half of Kentucky households having lost income, that puts us in a really dangerous spot. I brought up PUC, the stimulus checks, and then having savings to fall back on specifically because we know that those are the top 3 ways that people have made ends meet among households that have lost household income. And so with those being the three largest sources and three sources that are dwindling quickly, this calls for a really quick response, both through extending unemployment benefits and also putting out another round of stimulus checks. So let's move on to the next slide. Speaking of stimulus checks, so far, Kentucky has received about $4 billion in federal funds. To put that in context, our entire GDP is $200 billion. So we're talking about roughly 2% of our state GDP through these stimulus checks. Just looking at that graph on the right-hand side, there's a steep drop off and then there's a steep incline on the right, and then just sort of a steady increase moving on all the way through about the middle of June. That steep increase corresponds with the time in which the first rounds of stimulus payments hit people's bank accounts. So it's I think a pretty amazing just view of what putting money directly in people's pockets did for consumer spending, which is great that people are able to afford their basic needs. I think that's really important. The other aspect of that, though, that I think is really important is that means that other people got to keep their jobs, because the things that those folks went out and bought had to be sold by other folks or made by other folks. And so that meant that they got to keep their jobs, making and selling those consumer goods. At the same time, there are a lot of Kentuckians that haven't gotten their stimulus check yet. The Center on Budget and Policy Priorities estimates that 171,000 Kentuckians who receive Medicaid and SNAP haven't yet received a stimulus check, which is roughly $162 million. And that's a lot of money. And that's a lot of money that our economy has not yet received in federal funds. So, there's a role that I think we as advocates and community members can play in getting the word out. But there's also a role for the cabinet to play in reaching out directly to those 171,000 Kentuckians that they're in regular contact with to help them know, here's where you can apply. The application is incredibly simple. The IRS set up what's called a non-filers tool. It's essentially an application for your stimulus check, and it's only a couple pages long. So, we really encourage folks to do that, not only so that they can keep the lights on and keep paying the bills, but also so that we can have that money in our economy and keep other people in their jobs where they can continue to make a living, continue to provide the things that we all need, and hopefully stay safe at the same time. So with that, I'll hand it off to Jessica Klein. Oh, I'm just kidding. Dr. Schuster, excuse me. My slides are out of order.
Thank you, Dustin, and hello to everyone. I'm sorry that my camera is not working, but I actually am here. You can't see me. I'm Sheila Schuster. I'm a licensed psychologist, and I'm the executive director of the Advocacy Action Network. We're an umbrella organization that provides advocacy to people in need of behavioral health services and supports, as well as Kentuckians with disabilities and without access to appropriate services and overall health care. Next slide, please, Angela. So I just want to remind you all that behavioral health is an issue that is alive and well, unfortunately, during this COVID-19 time. Behavioral health refers to mental health issues as well as addiction issues. And as a psychology colleague of mine described it, and I thought it was the perfect description, COVID is really the trifecta of anxiety. We have the unknown with all the health threats of the pandemic and the unknown amount of time, the incredible feeling of the loss of control and the sense of great risk. So I guess I'm here to say that if you're feeling stressed, if you're feeling depressed, if you're feeling anxious, if your body is feeling that way, all of us are in that boat. We're all going to have these mental health challenges during this time. It's going to affect all of us, although we may feel it differently and may express it differently. Certainly anxiety and depression are among the most common symptoms that we're hearing from all age groups. And don't forget your children. Even the youngest child can be stressed and pick up on the anxiety in a household, not know how to put it into words or how to respond to it. I also want to point out that there's really another pandemic going on at the same time, and that's around the racial injustice, discrimination, brutality, and the racial trauma experienced by our communities of color. So if you are someone in the Black or brown community, if you know someone or are related to someone or work with someone or in the neighborhood with someone who is in a community of color, be aware that they're not only enduring the COVID anxiety and depression, but also really are in touch now with probably many years of repressed trauma and experiences of discrimination and in some cases brutality. And I really think it's a huge double whammy that will take its toll on our mental health, on our addictions, probably for years to come. Next slide, please, Angela. So as with physical symptoms, if we have already a pre-existing mental health or addiction issue, it's going to show up, it's going to exacerbate it or make it worse in this time of stress and anxiety. And we're probably going to have more trouble coping. So if you're someone who is already aware that you are prone to anxiety, if you're prone to depression, if you have a substance use disorder of some kind, those are aspects of your daily life that are going to be more affected in this time of high stress and anxiety. We are seeing across the Commonwealth more calls to our crisis helplines, more overdoses, unfortunately, more suicide attempts during the months of these pandemics. So a few tips, really, really helpful to get out and get some exercise. It's not only a safe way for you to do it, but exercise releases endorphins to the brain, which are natural uppers, if you will, and are a natural kind of antidote to depression and even to anxiety. Helpful to stick to some routines where you feel like you're getting something done each day. I think these days seem to go on endlessly, and without the typical structure of school, of work, and so forth, we sometimes feel at loose ends. So I always say start by making a list, and then you can check off the first thing, which was to make a list. So you're off to a good start before you start working through, and set small steps for yourself. If getting the laundry done is your major task for the day, then that's a good one, and it's going to take several steps on your part. So stick to that. Don't make yourself feel responsible for 10 big things that no one could get done in a day's time. I encourage you to minimize alcohol use. Alcohol is actually a natural depressant. People use it to self-medicate to other feelings that they have, but it's really not helpful in the long run. It also is not going to help you have really good restful sleep. And reach out to connect with others. One of the best antidotes besides getting exercise for yourself is to take the focus off yourself and how you're feeling and direct it toward reaching out to someone else. Is there a neighbor? Is there a family friend? Is there a family member that you haven't reached out to? Call them, text them. You know, we have some safe long distance ways of being in touch with others. Talk about how you feel and listen to others as they are sharing with you how they feel. And please, please, please get help if you're feeling overwhelmed or depressed. Every one of our local community mental health centers, and they serve all 120 counties, have a crisis line that is staffed 24/7. If you are feeling suicidal, there's a National Suicide Prevention Helpline, and we have that number there. You can get immediate counseling by calling these helplines. So before you do anything that might be harmful to yourself, please reach out and get help. There's no stigma attached to that. That's really self-care that you really need to be undertaking. Next, Angela. So I want to remind you how you're likely to get behavioral health services. Mental health counseling, therapy, addiction services are available across Kentucky. Not likely to be offered face-to-face, which may not be safe, but through what we call telehealth. So one of the good things that's happened is that the federal government has relaxed some of the rules during this COVID time so that more technologies are available. And they include even not only computer telehealth, but also FaceTime, or even just your cell phone can be used during this time of the emergency. The other good news is that Medicare, Medicaid, and most private insurance companies, including the state employees' health plans and the state retirees' health plans, are authorizing reimbursement for telehealth services, whether you're a current patient or a new patient, and most of them have suspended any copay or cost sharing. So hopefully there's no financial barrier. And of course, we're encouraging you to sign up for emergency Medicaid services if you are not currently with any healthcare coverage. So telehealth is being offered by your local community mental health centers, your private providers, and as I say, through various computer platforms. I guess the bottom line is it's a very natural human reaction to have these feelings of distress at this time, not only with COVID, but also with the racial trauma and injustice. So be aware of that, know when it's affecting how you are functioning, and reach out for help. Thank you. And now we'll turn it over to Jessica to talk about food insecurity.
Hi, y'all. This is Jessica. I'm with Kentucky Center for Economic Policy. I'm going to talk a little bit about a couple of different food assistance programs, and we'll go ahead and switch to the next slide. So the first one I'm going to talk about is the Supplemental Nutrition Assistance Program, SNAP, also used to be known as food stamps. About 1 in 7 Kentuckians are food insecure. And as of June, we have over 650,000 SNAP participants. While 76% of those are white, SNAP utilization rates are higher among Black, Hispanic, and other Kentuckians of color. And as you can see in this graph, since the beginning of the pandemic in March, we've had an additional 140,000 Kentuckians utilizing SNAP to help buy groceries. These largest increases are in Louisville and in more rural counties such as Magoffin and Lee, so across the state really. And as the pandemic continues and we see more closures, people losing hours, wages, and jobs, we expect to see more people utilizing these benefits for food. Next slide. So a few things that have been going on in these programs to help people during this difficult time. We have been utilizing the Emergency SNAP program, which provides additional benefits to over 157,000 households in SNAP, so that they're able to get the full amount of benefits for their household size. So it provides additional benefits of up to $181 directly to their EBT card. And we've been approved since April, so we just got approved for August. So those have been going on for a while now. We also used to have 6-month recertification extensions. So recertification began in June. So for people due, that should be coming up. But for people that were due between April and June, those have been extended until the fall. So some people did see extensions during that time. And then more generally throughout the program, there's been many different flexibilities within the program to help minimize those in-person services, be able to certify things over the phone, like income, proof of drug treatment, and we've waived work reporting requirements and also extended online purchasing through Amazon or Walmart, and including Kroger Click List to be able to buy groceries online and not have to go to the store. So all of those different things are meant to help. But even with the emergency SNAP, that leaves out about 40% of people. So what we really do need is for Congress to increase the maximum benefit by 15%. And what that would do is ensure that every household, including those with the lowest income, see an increase during the pandemic. Next slide. So the other program I wanted to mention was the Pandemic EBT program, P-EBT. And that's the program for Kentucky children eligible for free or reduced school meals that were affected by the school closures. So it provides money for groceries and up to $313.50 for each child as a one-time payment. So this doesn't change ability for other programs, but kind of just provides that extra funding on a card for people to be able to use. So some people did receive an automatic payment onto their EBT card if they participate in a program with an EBT card. And others may have received one automatically in the mail, but not everybody did. So for families that are eligible, they're encouraged to apply. It's a very simple application, just a few questions about your student that's eligible. So you need, date of birth, student ID number, and the student's name to apply. And it's on the Benefind website here. The deadline for applications is August 31st. Next slide. So these are the other food assistance programs I wanted to mention. There's been flexibilities in each of these as well, but the flexibilities really vary based on the region that you live in. So I wanted to provide the contact information so anybody could look up the region that they live in and see what flexibilities are happening within their program. The first is the WIC, Women, Infants, and Children program, which provides children under 6 and breastfeeding mothers with nutrition assistance. They're also minimizing in-person visits, that kind of thing, and some of the nutrition requirements to help people get more food. There's also senior nutrition programs, which you can contact the area agencies on aging to get information on that. Again, very regional provisions. They're doing things like doing pickups instead of and delivery instead of like in-person meals and that kind of thing. Additional meals for children, you can text food to 877-877 to find locations near you. And again, participation in P-EBT or SNAP or these other programs doesn't prohibit you from going to get food for kids. So that's still an option. And then with food banks, you can find all of the different locations at the Feeding Kentucky website. So I wanted to include that as well. I think that's it. I think Emily is next to talk about health insurance. Thanks.
Jessica. Yeah, we can go to the next slide. And before I start, I just want to remind everyone that if you have a question or a comment, feel free to put that in the chat box and we'll try to get to those. But wanted to give you some updates on health insurance, particularly Medicaid and Connect, but to just give you a little bit of context, since the pandemic began, we've had what we think is an estimated 233,000 Kentuckians lose health insurance because they lost primarily their employer-sponsored insurance. So when you lose a job, you lose your employer health insurance. We have more than double the number of Kentuckians who are now uninsured. We had 223,000 before the pandemic. You add to that 233,000, and that is a significant number of Kentuckians who need access to affordable care, in particular because we are in a public health crisis. And what you can see in this chart here, this is the estimate that Urban Institute did based on the rate of unemployment. So in that chart, you'll see what the estimate would be for 15% unemployment, 20% or 25%. And you can also see while employer-sponsored insurance is dropping because of the pandemic, the estimate of Medicaid and marketplace coverage increases. So you see that's a response to people losing employer insurance. But what I want to make clear here is that that increase in Medicaid and marketplace coverage is really only as good as our outreach and education to folks and their ability to know that what their options are, and then also apply and get that coverage. So we have a lot of work to do as advocates to make sure that people know what they're eligible for, how to apply, and make it as simple as possible to apply. So in addition to losing coverage for people who do have health insurance, I just wanted to share some relatively new information. In July, the Cabinet for Health and Family Services issued a new order that clarified that insurers cannot require a clinician's order in order to for an individual to get a COVID-19 test. And insurers also shouldn't be charging any out-of-pocket costs. Now, this was already true. This is what Congress intended when they passed federal relief packages back in March and April. But it's important to know that the government, Kentucky's government, has clarified this, and people should have no barriers to getting COVID-19 testing aside from just having a place that you can make an appointment and go in your community. And if you do have a barrier, I think in the past we've had a link to the Department of Insurance, and I'm sorry that I didn't put that in here, but there is a way that you can report that. So I'll find that link after my presentation is over, and I'll throw that in the chat box for you. Let's go to the next slide, Angela. Something else I wanted to share. This is something that Dustin presented last month, but it's important for us to remember that some Kentuckians face more barriers to coverage than others, and Black Kentuckians in particular are facing more barriers to coverage. Currently, or actually based on 2018 data, which is the most recent data that we have from the American Community Survey, we know that Black Kentuckians are uninsured at a rate of 6.4% compared to white Kentuckians at 5.4%. So there's a gap there. But it's even more critical right now that Black Kentuckians have coverage because they're facing higher rates of COVID-19 infections and death. And for that reason, while we know that there's a lot to that, there are a lot of historical inequities that have increased health disparities, that have led Black Kentuckians to be more at risk for COVID-19 infection and death. But having coverage is absolutely critical to being able to address immediate healthcare needs, and to do that quickly, preventively, proactively, and not wait until you're already sick and already really having some serious health issues. So we want to make sure people are covered as soon as possible and can get the care that they need when they need it with no delays. What we know about Black Kentuckians who are uninsured, at least again from 2018, a lot has probably changed with unemployment recently, but what we know is that about half are of working age. Most qualify for some type of public subsidy. So there should be about 8,800 Black Kentuckians who are covered by Medicaid now. Why they're not is probably because we're not doing enough in terms of outreach and education, assisting people with enrollment. And we have had over the past couple of years, although that's changed now, but there were a number of barriers in the Medicaid program that kept eligible people from either getting covered in the first place or keeping their coverage. So those may be some of the factors there. And we need to make sure that people know they're eligible and can apply and keep their coverage. Another 10,000 Black Kentuckians are eligible for marketplace subsidies. And that may have increased now, again, because of unemployment or losing income. But we know that that's the majority of people who are uninsured. And we are working with the Cabinet for Health and Family Services, talking with them about targeted outreach and enrollment. I know they have a plan that they're going to be rolling out soon, and that's going to be a tremendous help. There will be about 2,000 Black Kentuckians who won't be eligible for a subsidy or Medicaid, probably. And they're going to have a harder time finding that affordable coverage. But we do have presumptive eligibility, which we call temporary Medicaid, which is currently a coverage option for anyone, regardless of income. And that's something that I'm going to talk about next. Let's go to the next slide. So we have these two Medicaid options right now. There are actually three. I might talk about emergency Medicaid next month, but today I want to talk about temporary Medicaid and regular Medicaid. This temporary Medicaid, which again, the state calls presumptive eligibility, but that doesn't really mean much to most people. It's coverage that the state has expanded beyond typical Medicaid eligibility. So right now, if you're uninsured, if you're under the age of 65, you can enroll in presumptive eligibility or temporary Medicaid, regardless of your income. and that's because of the pandemic. And this coverage typically lasts up to 90 days, so the month you enroll plus 2 more months. And then the state is also allowing for another period of enrollment. So if you add it up, if you do it just right, you can get about 6 months of coverage. And since the pandemic began, we've had about 180,000 Kentuckians who have enrolled in Medicaid. Many came in through presumptive eligibility and then have since enrolled in regular Medicaid. But we have about 180,000 people newly enrolled in Medicaid. And that's really good. But clearly, whenever you look at those numbers I just presented, 223,000 already uninsured, plus an additional 233,000 newly uninsured, you can see that, 180,000 isn't covering everyone. The slide came back. All right. So we have our work to do to make sure people know what they're eligible for and are able to enroll. But with regular Medicaid, you can see here on the image what the household size and adjusted gross income is for enrollment. And there is a link there to temporary Medicaid coverage. The link to apply for regular Medicaid is benefine.ky.gov, and we can throw that in the chat box. Oh, I think it's just covered on my screen. It should be up there. And that's for 12 months of coverage. So regular Medicaid is the better plan. If you are eligible, that would be the way to go. But you get covered more quickly with presumptive eligibility. And again, the income requirements aren't as strict. So those are the reasons that we give people these two options. And like I said, people can come in through temporary coverage and then apply for regular Medicaid so that they get covered as quickly as possible. And if you are in need of substance use disorder treatment, it's better to apply for regular Medicaid if you're eligible because there are more provider options that way. Let's go to the next slide. There's many things that have changed during COVID-19 to make it easier for people to get covered, to keep their coverage. These are things that I've shared on past webinars, and so I won't go through the list, but I do just want to remind everyone that the Department for Health and Human Services has officially extended the public health emergency. It was set to end on July 25th. It has now been extended 90 days, so that's basically October 25th. And that's new since the last time we did this presentation. So that means that all of the things that you see listed there should be also extended because of that public health state of emergency. Let's go to the next slide, Angela. In terms of Medicaid and marketplace coverage, there have been some new things happening, and I did mention on the last webinar that MCO contracts were announced. Now there is a protest, that's the word that the state uses when one of the MCOs that wasn't selected says that they don't think that the process was fair and they want it to be reviewed. So there's a current protest. But depending on the outcome of that, we assume that the 5 MCOs who were selected will start their new contracts January 1st, 2021. And regardless of the protest or who the MCOs are, we absolutely know that open enrollment will begin in October, and that this happens every single year. And every single MCO enrollee will have the option of changing their MCO. You can select a new MCO if you want to, and there will be information about what the different MCOs offer in terms of, sort of extra benefits, their provider networks, and that information we'll be sure to cover when we have it. We also think that there's going to be a bigger emphasis on outreach and enrollment this year, and we'll have more connectors working to make sure that people have access to one-on-one assistance. And so that's very exciting. There's also, as I mentioned, going to be targeted outreach and enrollment to Black and Hispanic populations throughout Kentucky. And so that should be actually starting before October based on what we last heard from the cabinet. We have also been working with the Cabinet for Health and Family Services on an 1115 Medicaid waiver demonstration that they are now going to propose to CMS to provide Medicaid services, primarily behavioral health and substance use disorder treatment, 30 days prior to release from incarceration. So people who are incarcerated typically can't get any Medicaid services while they're incarcerated. It's just the way, like federal rules, it's not allowed. But with a waiver, we are hoping that for the 30 days before they're released, they'll be able to start getting access to these services so that there can be a seamless transition from being incarcerated, receiving these services, to being in the community, being already connected to SUD behavioral health treatment, and be able to continue that care without any gap. And that will really help people get a good start and be more ready to have healthy reentry into the community. So the last thing I wanted to share is that we've all heard the announcement that Kentucky is going to reconnect. This is our new hashtag. I hope you'll start using it too. And that's going to be for plan year 2021. So in 2020, we're going to, plan year 2022. So next year in 2021, during open enrollment, we will have our state-based marketplace again to enroll in, which will be that one integrated seamless system where regardless of your income, you can go start the application, and the application will say whether you're eligible for Medicaid or eligible for a marketplace plan, what subsidies you're eligible for. It takes about half the time. There's more access to customer service and one-on-one assistance. We can actually go to the next page because I think I cover that here. And it's also less expensive for Kentucky. So there are higher fees on healthcare.gov, which I don't think a lot of people realized whenever the last administration made the decision to move our marketplace to healthcare.gov. But for those 80,000 plus individuals who have been receiving their coverage through the marketplace, they've been paying 3% in fees, and that amounts to about $15 million a year. For Connect, the annual operating cost will be about $2 million, but there's also going to be a $5 million one-time cost next year to reconnect, to get our systems connected again and working seamlessly in the way that they did before. And so altogether next year, the cost to Kentuckians should be $7 million versus the $15 million that we've been paying for healthcare.gov. So significant savings and better customer service, really easier application, more assistance, less stigma, less confusion. Lots of reasons why we think that this is a good deal for Kentucky. I think that that's my last slide, so I'm going to turn it over now to Dustin.
All right. Just want to start by echoing how much of a better deal Connect is than healthcare.gov. That's all. It's just a great deal all around. So yeah, I wanted to go through where unemployment insurance is in Kentucky right now, and also some things that we should be looking out for. So let's go ahead and move to the next slide. So this is a bar chart of unemployment insurance initial claims just in the year 2020. So you can, if you look closely there on the left-hand side, there's some very small bars. Those are all anywhere between 2,000 and 4,000 claims per week. And then all of a sudden we hit the beginning of March, and there's this swell of claims. And this is really, again, resulting from both a desire for people to stay home and that drying up demand, which led to layoffs, and also public health measures to keep people safe and slow the rate of infection by shutting down certain businesses, and then those resulting in either temporary or permanent layoffs. So ever since then, it's been tapering off. We hit a peak of about 117,000 claims in 1 week, and then that started to slow down. And over the last 6 weeks, we've ranged between 20 and 30,000 claims per week. Now that seems maybe like a lot less than what we were experiencing, but to put that in context, the worst week of the Great Recession saw 25,000 claims, and then it quickly dropped down from there. So we've essentially had 6 weeks of Great Recession level initial unemployment insurance claims in a row now, which is a relatively low point of where we are. And again, I think some of that is because of these permanent layoffs that we're seeing. And it's hard to know for sure, but hopefully we would see this continue to fall, but with spiking cases and additional closures, as well as just generally lower spending, I worry about what that will mean for employment moving forward. The last week that we have data for showed 20,810 people with initial, first-time claims. On top of that, there were 140,000 people with continued claims. So these are folks who are asking for more than one check. That has decreased pretty significantly. Again, at the peak, we had 260,000 unemployment insurance claims. In addition to those 140,000 UI claims, there are 32,487 pandemic unemployment assistance claims. That's the program that's specific to, independent contractors, freelance workers, gig economy workers, and then other folks who may have otherwise been covered under UI, except their employer can hire them back, but they either have COVID-19 and so they have to stay home. Their doctor has suggested that they stay home for health reasons. Their child care center closed, and so they have no place to put their kids, and then several other specific reasons. So about 32,000 folks receiving that benefit. Let's move on to the next slide. So I want to start by talking about this chart on the right. This is the amount of money Kentucky has received on a weekly basis through pandemic unemployment compensation. PUC is that extra $600 a week that all UI and PUA claimants receive, or at least received through July 25th. This was an incredibly important benefit. We've really not seen something like this before, but it was a very good idea by Congress to make sure not only that folks could keep the lights on, keep food on the table, keep paying the rent check, but also to make sure that there was money in the economy more generally. So this has been incredibly helpful. It's averaged around $100 million per week. Earlier I said there was 171,000 Kentuckians who have not yet gotten their stimulus checks, which represents $162 million. During the height of this, we were receiving almost that much on a weekly basis through PUC. So it has had a really incredible stimulus effect that we'll talk a little bit more about in a minute. Like I said, this was a provision in the CARES Act. It expired on July 25th, and so folks start getting that money now. On average, people's unemployment benefits have been cut by 2/3, which is pretty significant. It's been even more dramatic for folks who receive PUA. Folks like barbers who may not have been able to reopen yet, people who work as freelance writers or independent contractors, small business owners, their benefits have been cut pretty dramatically. Regular unemployment insurance claimants, their benefits have also been cut pretty significantly, but not quite to the same extent. Now, in the HEROES Act, which was the stimulus bill passed by the House of Representatives, the U.S. House of Representatives back in May, they extended PUC through January 31st of 2021. They also extended PUA, which is set to expire at the end of this year, for another month for initial claims and another 4 months for continued claims. That would be a really big deal. And honestly, just pegging it again to an arbitrary date is not the best idea. Ideally, we would want to see that benefit taper off as the pandemic subsides and employment can resume safely and fully. But, it was better than nothing, which is currently what we have. Contrasting that with the Senate Republican passed bill, the HEALS Act, and we'll talk more about these bills later. The CARES Act allowed PUC to expire. This bill would not continue it. In fact, it would slash it by $400 per week initially through October. And then beginning in October, states would have to change their systems to start paying out 70% of lost wages. I think everybody has heard at this point how decrepit and old and inflexible our current UI system is. I think it's somewhat unrealistic to think that we could completely reconfigure it to start calculating lost wages, you know, in a matter of 2 months or less, depending on when this bill is passed or if it's passed in this current version. I mentioned as well, let's move to the next slide, that this has a really significant stimulus effect. I just want to mention that moving the PUC benefit from $600 to $200 extra all by itself, without any other changes in our economy, without any, you know, worsening of our current outlook for jobs, doing that would cost over 30,000 jobs between now and the middle of next year. And that's because when people spend that money, you know, that it generates further economic activity. It's something called the multiplier effect. And unemployment insurance has one of the strongest multiplier effects of any government program that we use. For every dollar invested in unemployment insurance or spent through unemployment insurance, it generates $2 in the broader economy during a downturn, which we are very much in. I showed this chart earlier. I liked it so much, I decided to use it twice. I mentioned before sort of the upward swing there on the right-hand side. But I think what may be even more incredible than that is just how quickly the downward slide stopped. And it stopped right at the same time that PUC checks started, you know, going out the door to folks. So PUC had an amazing effect when it came to just stopping the slide and allowing people to start paying their bills again. And then stimulus checks really were the thing that helped it bounce back up. So, you know, that money has now run out, and so will the effect. In fact, you've already seen there on the far right-hand side, there started to be a slide off in consumer spending. This also equates to about $70 million being pulled out of Kentucky's economy every week. It's not a small amount of money. That's a really significant stimulus for you know, being able to, again, pay the bills, but also keep other people in their jobs. This also corresponds with the lifted rent-based evictions moratorium, which we'll get into later. But you know, getting rid of this extra money for laid-off workers, of which there are, you know, 170,000 right now, and also starting to require them to pay rent at the same time is a very sort of dangerous cocktail economically. And again, as I mentioned before, temporary layoffs are tailing off. At the same time, permanent layoffs have begun to increase. So a lot of folks are being laid off with no chance of going back to their old jobs. And so they're out there looking for new work, even as you know, their neighbors and others are also losing their jobs. So with other people, you know, having less to spend through dried up savings accounts, dried up stimulus checks, and dried up PUC. It's not a great place to be right now. So let's move on to the next slide. I, in high school, was a big fan of Mythbusters, so I figured I would try my hand at some myth busting here. Folks, I'm sure, have heard, you know, this claim that this extra $600 a week is a bad idea because it's paying people more than they were making before, and so they just tend to stay at home. And there's a lot of reasons why that is patently false, and I just wanted to go through 4 of them. So the first is that, and this is important, workers aren't allowed to just walk away from their jobs for any reason and then end up getting unemployment benefits. And there's an asterisk there that I'll get back to. You have to be laid off through no fault of your own and for a couple other very specific COVID reasons that have just been introduced in order for you to be able to apply for unemployment insurance. Even if you do get laid off and you apply for unemployment insurance, there's no guarantee that you get it either for a host of reasons. In fact, before the pandemic, only 1 in 5 covered unemployed workers received unemployment insurance benefits. I think I've heard the governor say before that we've inherited a system that was designed to tell people no, and they've been trying to change that, and I think successfully to an extent, but that's still the system we're working with. The second is that when an employer tells the state that they're ready to rehire these workers, those workers' benefits are cut off. So there's a portal that employers use to let the state know that these workers that they've told the state, you know, I had to let them go, they're ready to bring them back. And so that triggers a moment for that individual's benefits that it says that you're done. You can't receive any more. And in order to receive the $600 PUC benefit, you have to be receiving at least $1 in unemployment insurance benefits or pandemic unemployment assistance benefits. So when that money goes, the extra $600 goes. So it's, you hear people talk about how employers have said, I want my workers to come back, but they told me they don't want to because they're getting more money. That has nothing to do with whether or not, they're allowed to keep that money if the employer has told the state they're ready to come back. The other thing is that getting people to 100% of lost wages or maybe even higher for very low income workers is worth doing because we're in a pandemic. Pandemic unemployment assistance that Tyler's actually going to talk about here in a little bit is specifically designed for people who are in a tough spot because of the pandemic. And so we want to make sure that people are held whole during that time. We want to make sure that folks are able to continue to pay the bills while they get well, while they avoid getting sick and potentially dying, while they try and find a place to put their kids. We're not in we're not in a moment in history when we have a lot of precedent. So we want to make sure that we keep people safe and at the same time, make sure that our economy doesn't tank. And then the last one, which I actually think is maybe the most amazing, is that a study out of Yale found that using some data about work, people returning to work versus staying back, they found that pandemic unemployment compensation actually increases the chance that claimants return to work. They compared folks who received the extra $600 compared to similar folks who didn't, and they found that there's basically no effect between the two, if a very slight positive effect for folks returning to work. So there's really good empirical data that shows that this doesn't make any difference. And that kind of makes sense when you think about it. If you as a worker have the choice between a temporary benefit that is going to run out versus a permanent job that may not be there later that you're being offered now, most all of us are going to take that permanent job because it offers more security. You know that it's going to be there in the long term, and you know that it's also an opportunity to better yourself versus a temporary benefit that's honestly a little bit of a hassle to continue to receive. So I'm going to stop there, other than to mention that this asterisk that I mentioned from the first line is that there are some specific circumstances that people can stay home from work and use pandemic unemployment assistance, which Tyler's going to explain now.
Yeah. Hey, y'all. Thanks, Dustin. You can go to the next slide, Angela. I'm Tyler Offerman. I work with the Kentucky Equal Justice Center. I used to work mainly on food and nutrition programs, but now also moonlight as a UI expert because you need wages in order to buy food as well. So Dustin already did a really good job going over a lot of the nuances, confusions, contradictions of our present unemployment programs and situation. I just want to go over a little bit about folks' rights when it comes to UI. I will preface this by saying there is the way things should go and the way that many of your clients or folks you work with might be experiencing this system. As Dustin pointed out, UI over the years has been designed to tell people no. And that is really hard to kind of turn around that Titanic or to shift that train when suddenly, because of a global pandemic, we want to be able to tell people yes so they can be healthy at home. So there are a number of situations you might find the folks that you are working with will be finding themselves in, and I wish that I could give you clarity around definitively if that should be happening or if that shouldn't be. But I say all that to say there's a lot of people trying to access the system that was built to prevent people from accessing it. So it's going to be hard. So just a couple things real quick. Dustin already went over good cause. So traditionally with UI, there's a very narrow set of circumstances that folks can even get unemployment. Usually only applies to if you're laid off, no fault of your own, and your employer does not contest that worker's application to UI. Now, PUA, the Pandemic Unemployment Assistance Program, which was a part of the CARES Act, broadened effectively the good cause that folks would be able to get UI under. They're listed here. I won't go over all of them, but almost all of them are COVID related, right? You get COVID, you have a pre-existing condition, your childcare is closed, you can't get to your job because of a quarantine, a doctor tells you you shouldn't go to work. So this broadens the ability for people to get UI. Now, PUA, the calculation is different than traditional UI. For the most part, people will get less under PUA when compared to UI. But like Dustin pointed out, if you get PUA, then at least before last week, you would get the $600 on top of that. I have no crystal ball that tells me the future as to what Congress will do moving forward when it comes to the 600. Will it be 200? Will it be 6? Will it be 4? I have no idea. But PUA will last until the end of the year, as defined in the CARES Act. So at a minimum, folks in these situations should be able to continue to collect at least some unemployment if they meet these special circumstances. Now, there's another term that I'll throw out there, which is suitability of work. So good cause for separation normally means, that's when you leave your job. So that allows you to collect UI when you leave. Suitability of work means should you return? Is the offer of work suitable for that worker? KEJC has actually sent a letter to the governor as well as the labor cabinet asking for some more clarification around suitability of work as some jobs open back up. Are they safe? Are they not? So we hope for some more clarity, but just know that workers do have rights. It's very confusing out there. There's a number of new programs. If you or a client has questions about their eligibility for unemployment under one of these expanded programs, we recommend you reach out to either the labor cabinet, or since they are inundated with requests and it's really hard to get a hold of them, reach out to your local legal aid program, especially if you or a client has been denied unemployment and you think that they fall within one of these parameters. PUA is retroactive, so as long as someone has applied, they should get back pay. And PUC should also be included in that back pay, but they need to apply. So we recommend people apply soon and try and get assistance as much as possible, recognizing, like I said, that it's sort of the Wild West out there. So if you have any questions, feel free to follow up with me. My contact information will be at the end. And then we're just waiting to see what Congress throws at us next. But I'll stop there and hand it over to Adrienne.
Hi, everyone. It's good to be with you. I'm Adrienne Bush with the Homeless and Housing Coalition of Kentucky. Next slide. Okay, so you may have heard that there's a little bit of confusion about whether people can be evicted for non-payment of rent and or other reasons over the past month or a couple of weeks, and it's gotten a little bit crazy. And confusing. The thing is, it doesn't really need to be. As far as the statewide eviction moratorium per Governor Beshear's executive order, that is still in place. It is effective through the duration of the state of emergency, which does not have an end date yet. And it was modified on May 8th to only cover evictions for non-payment of rent. The confusing part comes in where the Supreme Court of Kentucky amended its order at the end of July to allow evictions to be filed beginning August 1st. So if you or your client get a notice, contact your local legal aid office ASAP. Next slide. Okay, The homeowners and renters utility protections, those have not changed either because that executive order is still in place. For renters, national COVID-19 policies, those of you who were familiar with the CARES Act eviction moratorium may know that it expired on July 25th. Okay, great. And so now 30-day notices and evictions may now be filed with circuit court clerks. Similar to the state eviction moratorium, while it was in effect, it didn't relieve the tenant of responsibility for the rent. So we're very afraid that lots of people may have big back rent balances and now a court date. Now, to be clear, the governor has clarified in his press conferences that since his executive order is still in effect, he thinks that that evictions may be filed and accepted by the court system, but that an eviction should not actually be carried out. The problem with this is nobody really knows what their rights and responsibilities are, and it is incredibly confusing. And we all know how intimidating it can be to get a written notice from your landlord saying you have 7 days to move. So that's where we are on that. Next slide. Okay, so what does all of this mean for Kentucky renters? The answer is it's not great. So Dustin at the Kentucky Center for Economic Policy had written a blog at the beginning of July showing that nearly half of Black Kentucky renters don't know if they can make next month's rent. This was based on Census Household Pulse data, which we are getting weekly, bi-weekly-ish. And so we know that this was based on June data, was collected in July. At that point, it looked like about 1 in 4 renters. Most recently, we have data nationally, which paints an even more dire picture, and it looks like 48% of all Kentucky renters, regardless of race or place or whatever, are actually at risk of eviction in the next few months. Next slide. Okay, so as we know, there is money from the CARES Act that theoretically could help with this issue. Still not here yet. Next slide. And we also know that the CARES Act was a good start in addressing the needs of literally homeless folks and getting people experiencing homelessness rehoused. And theoretically, once it is here, it can be deployed for that. But in the meantime, there's still a lot more work that needs to be done. If you look at the unemployment numbers, the layoffs, temporary versus permanent, this is going to have long-lasting effects. So what we believe is missing from the HEALS Act proposal, which my colleague Kara Stewart will get into, is there needs to be a nationwide uniform eviction moratorium. The CARES Act eviction moratorium was fine, but it only covered about 1 in 4 properties, and it was kind of hard to determine which properties and people it covered. What really needs to happen is just nationwide, all renters, regardless of funding source, whether they're private pay or in a federal program or a state program, everybody just gets an eviction moratorium, okay? Number 2, there needs to be $100 billion in rental assistance. I know that sounds like a lot of money, and a lot of folks in the housing world are used to doing so much with not a whole lot of money. This is what it will take. It will literally take between $965 million and $980 million in Kentucky alone to get us through to next May, okay? And then the third thing is, as I said, the CARES Act was a great start. It wasn't enough. We need $11.5 billion. Sorry, I left off the B. It's 11, $6.5 billion in emergency solutions grant funding to address the projected needs of people experiencing homelessness. So that's all I have. I did see that somebody had posted Louisville's portal for renters, and that is at the end of the slide as well. So thank you, Celine, for pointing that out. And with that, I'll turn it over to Kara.
Hi. So this is the monthly update on what's going on in Washington. And so we can go to the next slide. So what's going on in Washington is negotiations between the Democratically controlled House and the Republican-controlled Senate. Of course, that Senate that is Republican-controlled is controlled by a Kentuckian, our Senator Mitch McConnell. So I do feel like we've got an opportunity to play an outsized role in that. And to go to the next slide. We went over last month. Use the next slide. We went over this last month. Nothing has changed here. The HEROES Act is the HEROES Act. It would help. It is good. And then what we are facing now, which has not actually been voted on or debated anywhere, but has been proposed by Senator McConnell, is the HEALS Act. So the HEROES Act does do a lot of things that would help our economy, would help Kentucky, including a lot of money that comes to Kentucky state government and county government, which is kind of the biggest deal to help dig out where we are right now and protect people, and also the increased FMAP for Medicaid, which makes a big difference to people getting their health insurance. It also does some very small things that don't cost much money but could change the health of people, including requiring ICE to provide soap and hand sanitizer, ICE being the immigration and enforcement, and being decent to people in detention, which I think is an appropriate in a global pandemic and all the time. It also protects voting rights and guarantees safe voting, which we definitely need here in Kentucky, and protects the USPS, which are some things that are not included in the HEALS Act. So we can go to the HEALS Act, which I know has been tossed around some today. There's a lot to it, but the big deal is that it does not send any money to our state and local government except for this money for education that's like got strings attached to it, and it is 1/3 the size of the HEROES Act. You can imagine if it cuts 2/3 of the money out, it cuts a lot of the benefits out. And included in here some of the specifics that were different, like for example, the stimulus check under the HEALS does not have an age limit for dependents versus the HEROES, which still does. And the major change, which we've heard from Dustin and Tyler about, is with the unemployment, where there's just not enough in HEALS to actually prevent harm to families in Kentucky. And of course, like we just heard from Adrian, the HEALS Act does not at all address evictions or rental assistance. And that is a completely missing component from the HEALS Act. That is something that we have to have. I think that seems super obvious, I think, to anybody that's paying attention, that we have to have protections from evictions, because we cannot be healthy at home without homes to be in, and we cannot expect our neighbors to be able to be healthy at home and help protect all of us if they don't have a place to be. And the rental assistance is in the HEROES Act. So we can go to the next slide. And the comparison, even being as generous as possible to the good things in the HEALS Act, the comparison is not close. The HEROES Act is good. It covers a lot of what we need. Not perfect. The HEALS Act is missing a lot, especially and everywhere. The not addressing evictions rental assistance is just a huge hole, and the not enough for unemployment. So the back and forth between the negotiations, we'll see how that goes. But for now, we need to contact Senator McConnell. You can go ahead and go to the next slide. We need to contact Senator McConnell and talk to him about this. As Kentuckians, that is definitely, our duty. He represents us, and he is the person who is leading the negotiations from the Senate for the HEALS side. And we need to make sure that our voices are heard. So there's the contact information to contact Senator McConnell and make sure that we ask that eviction moratorium be included which, by the way, we're now at 7 states where the moratoria has been upheld. So those moratoria are perfectly constitutional and legal, including what Governor Beshear has issued right now, and that we get enough money to our state and local governments that they're able to function. So get in touch with McConnell. Don't be shy. He represents us, but it definitely has tremendous impact on the entire country. So let's take advantage of our position as constituents of Senator McConnell and give him a call. And then we'll go over to Angela to talk about being counted so that we have the right representation in the future.
Thank you, Kara. I'm Angela Cooper with Kentucky Voices for Health. I just want to talk briefly about voting. You can go to govoteky.com to check your registration and get the latest on how we're going to end up voting in November. Obviously, some of that's still up in the air, but that resource is a really good one, and they usually have the most current information. 2020 is an extremely important election year. There are 65 House seats and 12 Senate seats on the November ballot, in addition to the U.S. President, 1 Kentucky Senator, and 6 Kentucky congressional seats. So the general election will be November 3rd. We just don't know the method yet. The registration deadline is Monday, October 5th. Get active in your local races. You support candidates and spread the word to increase voter turnout. That's a totally nonpartisan thing that you can do. Encouraging people to register to vote is a nonpartisan thing you can do. Obviously, if you get involved with a race, it's going to be a little partisan. But elections have consequences. Be sure to vote. It matters. And have you completed the 2020 census? Our census response rate is 65.9%, which I believe surpasses our 2010 census response rate, which is terrific. This is the first year that you can complete the census online. It is not too late to complete. You have up until August 11th before census workers start knocking on doors and doing the socially distanced outreach work that they are going to be charged with doing among a pandemic, which is going to be pretty tricky for them. The census data are used to determine what federal dollars Kentucky receives for a lot of programs, infrastructure programs, education programs, and we risk losing over $2,000 per uncounted individual. So everyone who lives in the United States is compelled by the Constitution to complete the census. So get out there and do it. I am going to turn things over now to Emily Beauregard for resources for advocates and consumers.
Thanks. Let's go to the next slide. So some of these are resources that we've shared before. I think everything that's on this page. And we can go to the next slide. These are resources specific for folks who are experiencing homelessness or need help related to housing. We can go to the next slide. These are, if you're more into the policy side of things, you can go to these various trackers, Medicaid, SNAP, and COVID-19. These are updated regularly by Destin and others at the Kentucky Center for Economic Policy. And you can see, what's happening related to these different topics and get great, information. It's kind of an archive. There's also really good data that you can find here. So it's a good place to go if you are looking for something specific related to Medicaid, SNAP, or COVID. Let's go to the next page. And I know that we've talked about contacting legal aid if you have particular issues. One of them was related to employment. Housing can be another issue. There are a number of things that legal aids can help with, and there's contact information here for legal aids that serve different parts of Kentucky. And if you have other questions about legal aid, I would recommend reaching out to our partners at the Kentucky Equal Justice Center. They're a great resource too. And then stimulus checks. Justin mentioned applying for stimulus checks. If you know people who haven't applied yet or haven't received their stimulus check for some reason, or if you work with networks, you work with communities where people are less likely to file for taxes, then I think it would be really useful to share this information and encourage people to fill out this the non-filer tool so that they can get their stimulus check. Like he said, there's about $160 million still on the table, and we want to make sure Kentuckians are getting paid and that money is going into our economy. We can go to the next slide. And then I've shared this in the past, but just want to continue to invite folks to work with us on sharing their stories. Stories about access to health, access to food assistance, to housing, experiences with COVID-19. So we do have a professional videographer on contract now. His name is Ryan Morris. He's worked with us in the past. He does beautiful videos and really tells sort of the essence of someone's story. They're very respectful. We work very closely with the individuals so that we're telling the story that they want to share, and in a way that they feel is respectful and is really, valuing their experience. And so this is different, very different from like working with a journalist or a reporter who might have their own angle or agenda. We're really working with the individual to tell their story, and we want to share those stories because it helps us to advocate for these good policies. So when we have that video, or sometimes it may be print with an image, we can use that to share with legislators. We share it on social media, we share it with our networks, so that people have a different understanding of how these benefit programs and our safety net are just so critical for Kentuckians, and why the safety net is there to help all of us. But specifically, when we're thinking about these anti-racist and anti-poverty policies, why it's so important for us to continue to do that work. So there's Ryan's contact information. You can also always reach out to me if you have any questions about that. And then these are monthly advocacy webinars now, and you can see the dates for, they're the first Tuesday at 2 p.m. We will be sending out a registration link for these other dates in our follow-up, along with the recording of today's webinar. We also have here the recording from our Advocacy 101 training that Dr. Sheila Schuster did in July. And that's something that you can continue to go back to. And I find every time I listen to Dr. Schuster talk about advocacy, I always learn something new. And there are CE credits that are available both for the Advocacy 101 training and also for today's webinar. These monthly series, we've been approved now for CE credits for licensed social workers and for certified community health workers. So if you're interested in getting those credits, you can reach out to Angela. And Angela, if you don't mind putting your email address in the chat box. One other thing that I wanted to share today, and related to the federal relief that we're advocating for, is a survey that we've put together to collect stories related to COVID-19 and to collect people's their comments about what they think we need in Kentucky as far as federal relief goes, what their priorities are, what policies they support. And so it would be fantastic to have your help, not only in completing this yourself, that would be great, also sharing it with your networks and encouraging people to complete this. And if people want us to, we'll also share their stories publicly, but we're happy to keep that information private as well. So I think, yes, Angela also put in there that you get 1 CE credit if you're a community health worker, 1.5 if you're a social worker. So again, if you need more information about that, you're welcome to reach out to us. We have, let's see, a few minutes for questions if anyone has questions. And if you'll go to the next slide, Angela. Just want to make sure people have all of our contact information. So you can see our social media handles, our email addresses, and our websites. So if anyone has questions, we'll just open up the floor right now. And if not, we might be able to end a little bit early today, which will be a new record for us. All right, well, thank you everyone for joining us again. Hope to see many of you in September.
Thank you.